Okay. Okay, so my topic is rapid evolution, oral bacteria, and dental health. So this is what I'm going to be covering. So I'm going to have like a brief introduction, and then go through my inspiration for why I chose this topic, and kind of like some of the sources of like inspiration of like, like what I drew from, like what I was exposed to and drew from, and like you know how you like steal all your information from other people, like just like where I got my information, and then I'm going to talk about diabetes and dentistry, carcinogens and dentistry, and then we'll have time for a discussion if anyone has questions. Okay, so my introduction is, so this is my topic inspiration. So I'm attending a program called Zagoni Pre-Dental Bootcamp, and it's an 8-week intensive, and so we go to Zagoni every other Saturday, and so we have lectures and labs, and so my topic, rapid evolution oral bacterial and dental health, was heavily inspired by the course content that I was like serendipitously like exposed to during PDB, and like these topics aligned with my interests and college experience, like to the degree that like it inspired me to like make this presentation. So that's basically it. And also, if you actually, I'm not sure if there's any pictures here, but Trisha's also a PDB student, so that's how I kind of know her. And I think she was also one of the reasons why I was chosen to present. And I think because I expressed interest too. Yeah. Okay. And then, so this is another part of my inspiration for this topic. So, okay, does anyone see like a pattern with the pictures here? It's okay. Okay. It's like I'm just like mostly like sedentary, and it's a lot of like it's a lot of snacks. So like I've been snacking a lot in college, and also like drinking a lot of sugary drinks, which is okay, but like it's like not the best. So like when I went to PDV, and after like the first few weeks of college where I was like indulging at like the highest degree, I like definitely resonated with some of the things that they presented, and I like kind of felt bad about myself, but it like made sense. Okay, so when PDB like talked about the basics of dentistry for the first meeting, it was like they were talking about caries and gum disease, and how oral health is like correlated with like our entire systemic health. Um, like they emphasize like the correlation of oral health with diabetes in ways that didn't come to mind like immediately. Okay, so diabetes and dentistry. So caries and gum disease. So why does dentistry exist? Caries disease, or like cavities, is like a multifactorial biofilm breakdown of tooth enamel and demineralization by acids produced by oral bacteria. And this occurs simultaneously often with gum disease. And these diseases are the most prevalent disease in the world for humans. Actually, I'm pretty sure for humans, but it could be for other organisms as well. Um, but it is reversible if caught at onset or early enough in the demineralization process. So, what we've like stereotypically been taught is that sugar causes cavities, and the scope of like poor oral health is, but like the reality is the scope of poor oral health is linked to your systemic health and your like entire body. So my mom, she's a dentist, and she always said that being a dentist is treating the whole body. And it started to click more when I was exposed to like the content course, that the content topics that were at PDB. They were talking about how it's not just like the exposure of sugar that demineralizes your teeth, but like systemic health complications. And oral health is normally just like a manifestation of an undercurrent of like multiple pathologies in the parts of your body. So remember how
In bio, we learned that we are more than a sum of parts. There are like emergent properties. So when something is wrong, it's normally connected to like at least 10 other things. So my dad is also a periodontist, and so he's like an expert of the gums, right? And he emphasizes inflammation a lot, and he says often that all health problems are related to inflammation somehow and somewhere in the body. So here's gum disease, right? So this is why we need to like take care of our oral health. There's like cavities and there's also gum disease. So inflammation is basically when like the film, there's like a film that forms between your tooth and your gingiva, and like this foreign body causes inflammation, right? Like there's like an autoimmune response sometimes as well, and so how Jagoni like described it was like they have like this analogy that they use over and over, like with the house being the tooth being an individual and the gum being the house. And if the house is not properly built up, and if there's like a deteriorating house, then the individual will leave. And that's why sometimes you have like extractions and other dental procedures that you like have to do. Okay, so this is just like a review, like a really quick review. So like this is what we have to do to like remedy cavities and gum disease. We have like restorations, so that can be direct restorations like composite or amalgam fillings, indirect restorations, crowns and bridges. We have dental impressions and models, which are like intermediate steps in order to make indirect restorations like bridges and crowns, which are so direct restorations are like fillings, so like you drill and then you fill, right? And then indirect restorations can be crowns and bridges, which you work on outside of the mouth, and then you have like multiple visits and you have to like communicate with the dental lab, right? So and then we also like do anesthesia and perform oral surgery, like tooth extraction, especially when like there's just so much decay. Okay, so now one thing dentists always ask their patients when they're like filling out their charts is their medical history is if they are diabetic or not, because this kind of gives them an idea of like because diabetes has a really high association between with like caries and gum disease. So what I was talking about earlier, how eating sugar doesn't just affect your teeth in the ways that you would expect. Like sugar just being exposed to your teeth, it like demineralizes, right? But then when you have so much sugar to the point where it's a long-term disease, it will having sugar in your blood like demineralizes your teeth and inflames your gum in the long run, because your teeth are like constantly being like supplied with sugar, because in the case of type 2 diabetes, where you have insulin resistance due to lifestyle factors, you can't like lower your blood sugar level, so then you just have a much higher risk of caries and gum disease like 24/7 basically. Okay, and we're kind of like at an arms race with like the American like food industry, with like its ridiculously over processed foods and like the lifestyle that is like most popular right now, like gaming and a lot of screen time and sugary drinks. So yeah. Okay, I'm gonna move on to carcinogens and dentistry. Oh wait, there was like an important point. Okay, like actually, okay. So like what people normally thought was that there was like a linear like intensity increase of like the effect of sugar and teeth, but once like you get diabetes or something like that, it would like it's like an exponential like increase in intensity and negative effects on your teeth. Okay, so carcinogens and dentistry. So this is a New Yorker article that is really good. I recommend it a lot. I listened to it and then I liked it so much, so I reread it. It is a 43-minute read though, so I kind of just like it's a collection of experiments and research and interpretations and incidents to like help us like arrive at this new theory for carcinogenesis or the development of cancer and malignancy. And I kind of summarize it. I don't go like in depth, so don't worry. Yeah. Okay. So carcinogens. How do we know something is a carcinogen? Because an agent caused DNA mutations in human cells, and this famous researcher Ames reasoned that it was likely to cause mutations if something caused mutations in bacterial cells, it's likely to cause mutations in human cells as well. And so he measured the mutation rate in bacteria using fast-growing, easy-to-culture strains of Salmonella. And so this is like the standardized way of like it's a standard lab technique for like classifying something as a carcinogen or not. So, but in his paper, he outlined the method with like a bold title: "Carcinogens are mutagens." So, in doing this, though, um, he limited our scope of carcinogens by a lot. Um, so, like many scientists, though, including Ames, realized from the start that the test wasn't a comprehensive method for catching carcinogens because there are a lot of substances out there that are involved in cancer-causing mechanisms, but aren't mutagens themselves. So they don't cause mutations in DNA and cells themselves, but are definitely like they are definitely agents in that process. So so that means that we are incredibly underestimating the cancer-causing potential of many substances. Um, an example would be DES, which increases risk of vaginal, cervical, and breast cancer, but it's not classified as a carcinogen because it's not obviously mutagenic in cell cultures. And so there are just like many substances that we don't recognize as carcinogens. So, in one experiment, two researchers working at Oxford um, assembled a group of mice, and they basically clipped a patch of hair on each of the rodents' backs, and painted the patches with a cancer-linked chemical. But they only found that one animal in 38 of the animals developed a malignant lesion, which was really interesting. So, but then when the researchers added croton oil to the same area, the results were different. So croton oil is like this blistering inflammatory liquid from like the seeds of an Asian tree, and it was basically used like as an exfoliant. And so what it showed was that like putting this cancer-linked chemical on lesions wasn't enough to cause like tumors and malignancy. There needed to be like an added layer of like inflammation somehow. So there was so like initially you wouldn't even classify the cancer-linked chemical as a carcinogen, but then there needed to be like an extra step to cause like tumors to be activated. I mean to be activated. So yeah. Um, so inevitably we realize that there are many mutant cells that we have in our body that are just like destined to be cancerous. And a team examined pieces of normal lung tissue from human patients using deep sequencing methods and found that there were like 1 in 500,000 cells were mutant cells, um, which sounds really small until you like factor in that lung cells are like there are many lung cells, so that means that there are also a lot of mutant cells. So in our body we have a whole bunch of like mutant cells that are just in dormant, and there are a lot of substances out there that if they
if they're involved with them, can definitely cause cancer. So yeah, okay. So there's a whole universe of promoters out there that we're missing. So promoters are chemicals or substances that we don't classify as carcinogens, but um, are like very clear agents in the process of cancer. So these can be irritant chemicals from like substances that we eat or chemicals that we expose our children to or anything in the environment that we just like breathe. Okay. So a lot of the time we live without knowing what we could be doing and what we could be exposing ourselves to. So this is like in the post-war years, um, the average American Joe like might have been working in the Patterson's Union asbestos and rubber company factory, which like oops, sorry about that. And they basically um, these men came home like every day covered with asbestos, right? And they would like even like give asbestos to their children to play with, without knowing anything. And it was just seen as like a like occupational hazard at times. Like there seemed to be like a pattern of like lung like disease, but then no one like kind of said anything, right? Because like it wasn't like seen as like carcinogen. Um, so the research remained inconclusive, but then the study found um, yeah. So it was basically that asbestos is kind of like an irritant. So like just the presence of it kind of stresses out your body, and it doesn't like cause cancer itself, but it's part of like a cocktail of a bunch of different factors acting at the same time and over a long enough duration to cause cancer. So you have these mutant cells, right? And then asbestos, just like the presence of it, irritates you enough to like have some of these cells stop being dormant and become active, like actively cancerous. So like have you guys seen like the housing portal and like the form with like asbestos? So it's like what they're like kind of warning us about is that like asbestos can definitely be irritating to people. And here, like it was just used as like an insulation material. It was like fireproof, and it would be good for like heat insulation in buildings. So what they think really happened is like the fibers like summon like macrophages and other immune cells to produce like scarring and inflammation in the lungs, and then this is like the irritation that like causes all these like malignant clones that are already inside you to like awaken. And then like cigarettes, like the chemicals in the tar and like they also cause mutations. Fine soot particles are also irritants, and um, air pollution is also like another irritant that can definitely cause cancer. So, but like cigarettes though are like in short they're like the most troubling trifecta because not only do they like they're like an inflammagen, they're like a mutagen, but they're also an addictogen, all like wrapped up into one, like conveniently into like one cylinder. So you get like addicted to like constantly like exposing yourself to this mutagen, like known for causing cancer, and an inflammagen, which like is known for like making that even worse and like awakening all the mutant cells already in you. Yeah. Okay. So carcinogens and dentistry. Okay. Long story short, it might be unhealthy to like worry too much about all of this right now, and there isn't like too like okay like there's not too much like dangerous like risks to you. Okay, so you're fine. Okay, um, but there are definitely occupational hazards, but nothing that we know of that is like too bad. But there's also that like there's a lot that we don't know of, and like
even then, like the factory workers in that asbestos rubber like union factory, they like didn't know about like their occupational hazards either. So it's just best to be like as safe as possible, um, like in a reasonable way. Okay, so there are dental technologists, and in dental labs, I feel like this is like the most like this is like the worst environments. Actually, yeah, probably. Because you're going to be exposed to carcinogens in the lab where there's going to be like dust and chemical fumes, and you're normally in a confined space. And if there's like conditions of like poor ventilation, like it could be really bad because indoor pollution is like more than 100 times higher than indoors. Than outdoor pollution, and there's going to be a lot of like solvents, acids, and gases and vapors released during the polymerization, metal casting, and porcelain baking of resins, alloys, and ceramics for the different indirect restorations I was talking about earlier. And then, yeah, okay. So for dentists, right? There's definitely like um, this kind of like infamous thing about silver alloy amalgams. They have quite a bit of mercury content, which is kind of controversial, and um, but the consensus is that it's generally safe. But there's like the risk of mercury vapor and nitrous oxide being exposed during procedures, and if the patient like chews or eat something acidic or like grinds their teeth. So that's why pregnant women and children under 6 are always like not recommended to get any amalgam fillings. Um, there are other materials as well, but most fillings, to be honest, have something toxic. I did a lot of research, but yeah. So there's also like the ethical consideration of like the level of treatment and patient benefit, and like also while weighing in your own pay. So it's always something that you have to like be mindful about, and it's pretty hard to it's I don't know how to say it in like a general way, but it always like varies from case to case. There's also like even in like non-silver alloy amalgams like composites and stuff. There's also like beryllium or BPA, which is bisphenol A in plastics, and there's also like fluoride, which is like you think that it's good for you because it's in your toothpaste, but when you have too much fluoride, it can cause like really bad things like allergic reactions, Alzheimer's, anxiety, like autism, autoimmune disorders, cardiovascular. Yeah, there's like a lot of like really bad um, things that can occur from too much exposure to toxic chemicals and substances. But for mercury, at least, it's not gonna like you would. I think you would need at least like 300 fillings for it to be like really toxic for you, like to the point that you actually like have like it's like an actual hazard. So yeah. So yeah. So my conclusion is that I realize in life there are a lot of decisions that we're gonna likely make that will lead to worse health conditions, and there's no choice. But then the rest of the time, it's like you pick your own poison, and there's a bunch of random combination of factors at a time that like leads to like worser health conditions, like caries and systemic inflammation and diabetes at the same time, or like exposure like to some type of chemical autoimmune reactions, malignancy, and carcinogenesis. Like that's what leads to carcinogenesis. Um, so like kind of like a full circle like return. Um, so now you kind of have like a better idea of why dentists ask about diabetes and smoking and allergies to materials before we treat a patient, and like the need to consider the whole body um, and like the individual case because there's like a lot of factors. Okay,
And then these are my sources, and that's basically it. Yeah, this is the attendance form, so you guys can get points. Yeah, do you guys have any questions? Oh, okay, so like diabetes or like carcinogens?
Or not diabetes, but
Like sugary drinks?
sugary.
Oh, okay, like processed foods. Okay, honestly, like for oral health and systemic health, I think, okay, it's kind of hard, right? But I think, I think diet is like a big factor in all of that. And I was even talking to my bio professor today about like apparently he lost like 65 pounds or something, like in like a few years, like because he was like 215 or so. Okay, yeah. Anyway, but he was saying how like diet has a lot to do with your like systemic health, like your entire like health, and carcinogens like that's more of like chance events, you know, um like you're exposed to this thing, you have like this like cancer cell, like this mutant, and then it like stops being dormant, and then like it becomes malignant. There's a lot of like things that have to happen at the same time. Yeah. Any other questions? Oh, oh, after doing this research, um, wait, you said life decisions? Um, I feel like okay, honestly, like you know, like the pictures, like where like the topic inspiration part two, with like all the snacks. I've been eating healthier because I definitely okay, honestly, like, not too much healthier, but like I've definitely been eating healthier. Yeah. Yeah, definitely. Cause also like silver amalgam fillings, like if you give it to a pregnant woman, right? Like you directly expose the fetus to the mercury, so that's like really bad. Also, like the highest like exposure of the mercury, like the highest volume of exposure, like the vapor, is during the dental procedure. So like when it's like already like a filling, right? It's not like releasing as much mercury, but like it's like all at once basically. And then but if you like grind your teeth a lot or like you eat a lot of acidic foods, then that can be bad. But yeah, you definitely should tell, or else like you could do some really bad harm. I got. Oh yeah, yeah, they definitely had like a much higher like incidence of like lung cancer, and it was this specific thing, melanoma, and it basically there would be like malignant tumors that would also like grow into their spine. So it was super painful and a really bad way to like to go. Yeah. Okay. Oh yeah, go ahead.
I was wondering if you think that there's a higher chance of being around patients in other productions versus industry.
Um. Okay. Honestly, like I think I think dentists are like more exposed to like more carcinogens because just because of the fact that we work with like substances like in like fillings and in indirect restorations and direct restorations, and also like dental lab, like we like we have yeah, there's like nitrous oxide too, and then like anesthesia and everything, and yeah, so there's a lot of stressors and a lot of inflammagens and different things that can cause um, that yeah that can like cause mutant cells to go crazy.
Um, but then again, like you don't really know because like sometimes like there was something toxic all along, and then like we just didn't know in our like in the time that we were working, you know. So it's kind of scary, but thank you for coming.